Strabismus surgery strengthens or weakens eye muscles, which changes the alignment of the eyes relative to each other. This surgery is typically performed as outpatient or same-day surgery under general anesthesia. Often surgery is performed on both eyes, even when it seems that only one eye is misaligned. The eye muscles are located on the surface of the eye under a thin layer of transparent tissue called conjunctiva. To access the eye muscles, a small incision is made in the conjunctiva. At the end of surgery, this incision is closed with small sutures, which slowly dissolve on their own. They do not need to be removed. No incisions are made in the skin. Eye muscles can be loosened, called a recession, or tightened, called a resection. A recession weakens the muscle function by changing the attachment site on the eyeball. A suture is placed through the muscle at the attachment site to the eye. The muscle is cut from the surface of the eye and reattached further back from the front of the eye. A resection involves shortening the muscle by removing a small portion of it, thus strengthening it. For this procedure, a suture is placed through the muscle at the intended new attachment site. The segment of the muscle between the suture and the eyeball is removed, and the shortened muscle is reattached to the eye. After strabismus surgery, the eyes are not patched or covered. The white part of the eye may be very red. It may take several weeks for the redness to completely disappear. Initially, there may be a small amount of blood in the tears, which should resolve within a day or two. The morning following strabismus surgery, the eyes may be crusted shut upon awakening. If this occurs, simply wipe the excess discharge away with a clean, damp cloth. Patients often describe a scratchy or gritty feeling in the eyes after surgery, which lasts only a few days. The eyes may be sore, especially with movement. I recommend over-the-counter pain medication like acetaminophen or ibuprofen for post-operative pain. Typically, stronger prescription pain medication is not needed. After strabismus surgery, you may typically return to your normal daily activities within a few days. I do advise, however, no strenuous activity or heavy lifting for at least 2 weeks. Other activities to avoid for the first 2 weeks after surgery include swimming and exposure to very dirty or dusty environments, such as playing in a sandbox. Bathing and showering are fine after surgery. Just avoid submerging the head completely underwater or having the shower spray directly into the eyes. Anytime surgery is done on the body, there are some risks involved. For strabismus surgery, major complications are extremely rare. In about 1 in 100,000 cases, a serious infection develops which can hurt the vision or the eye itself. Other major complications may include significant bleeding, retinal detachment, or loss of vision. Again, these major complications are extremely rare. Minor complications such as conjunctival hemorrhage, inflammation of the surface of the eye, or scratches on the surface of the eye may occur. Typically, these things resolve on their own. Double vision may also occur after surgery as the brain adjusts to the new position of the eyes. This typically also resolves in a few days to weeks following surgery. Every effort is made to completely align the eyes with one operation. However, this is not always possible. Sometimes overcorrection or undercorrection can occur, and additional surgery is needed to further straighten the eyes. During strabismus surgery, eye muscles are reattached to the eye with small stitches, which dissolve as the muscle heals. If one of these stitches loosens or breaks before the muscle is completely healed, more surgery may be required to locate and reattach the slipped or lost muscle.